Good afternoon, everyone. This is Nishant Kumar. I am assistant professor working in the field of pharmacy, Khalsa College of Pharmacy, and I am here to give a small talk on profession of pharmacy as well as the basic term which is mostly used in the field of pharmacy, that is pharmacokinetic and pharmacodynamic principles involved in pharmacy. Okay. Now, when a student comes in pharmacy profession, they come across with a term known as pharmacokinetic and pharmacodynamic. So we will be looking for a very basic, understanding about what do you mean by pharmacokinetic and what do you mean by pharmacodynamic. And this principle is basically used for discovery and research of the drug. Okay, apart from different dosage form, this is also used for basic research purposes. Okay, so in the field of pharmacy we always talk about the dosage form. Dosage forms are nothing but the medicine or the drug which is given to a patient either in the form of tablet, either in the form of capsules, suspension, emulsions, and many things. Okay, so those formulations, those presentation of drugs to the body is known as a formulation. Okay, now two things happen. Suppose a patient or a candidate is given with a drug, a tablet has encountered into the patient's body. What is going to happen? Two things in the field of pharmacy we observe. Two things. Okay, first, the drug is going inside your body and it is likely to give pharmacological action or the purpose for which the drug is given. For example, a drug is given for headache. Okay, so drug in the case of, for headache we give paracetamol. Most commonly drug is paracetamol. Now paracetamol in case of fever also we give. Now the purpose of this drug to go inside the body and to produce the action like it will reduce the headache as well as it will decline the body temperature. Okay, so this is known as pharmacodynamic of the drug. So what drug is going to do in the body is known as pharmacodynamics of the drug. Now another part is pharmacokinetics of the drug. Now what do you mean by pharmacokinetics of the drug? Now when the drug has gone inside the body is going to respond to that drug. Okay, and that is known as pharmacokinetic of the drug. First part is the drug has shown its action, that is pharmacodynamic of the drug, and in response to that body will also give some response to the drug, that is known as pharmacokinetic of the drug. Okay, now what body will do with the drug? Body will, the first step the body is going to do is it is going to absorb the drug. Okay, that is known as absorption of the drug. After absorption of the drug is likely to absorb into the blood, and from blood it is going to get distributed. So that is known as distribution of the drug. So first step of pharmacokinetic is absorption. Second step of the pharmacokinetic is distribution. Now the third step is drug is likely to get metabolized in the body. Okay, after distribution it is likely to metabolize. Metabolism is the process by which it will get converted into, there are many enzymes present in our body, in liver, in so many parts, so they are going to convert those drugs into some metabolites form. So that is known as metabolism of the drug. Okay, now once the drug is get metabolized, the final step for the drug is to go out of the body, and that is known as excretion of the drug. Okay, so these the time procedure for the drug which it undergoes absorption, distribution, metabolism and excretion of drug is known as pharmacokinetic of the drug. Okay, so this is the basic difference between the pharmacodynamic of the drug and pharmacokinetic of the drug. Pharmacodynamic means the what drug is going to do with the body, and pharmacokinetic is what body is going to do with the drug. This is the basic difference between pharmacokinetic and pharmacodynamic. Now next question comes, when we take the drug inside the body, suppose we are taking a tablet from our oral route, it goes inside our GI tract. okay, that is your gastrointestinal tract, and there it gets, first step is it gets disintegrated, okay, means fragmentation of tablet will take place. Fragmentation means it will get dissociated into smaller pieces, okay. After that, drug will solubilize with our GI tract system, means GI fluid, that is gastrointestinal fluid. It is going to dissolve in that, and from there the drug is going to get absorbed into bloodstream, okay. So whatever we take, either food, either food or drug, it is likely to appear in your bloodstream, okay. That is, we call it as systemic circulation. Now when drug goes into the from GI tract, the transport of drug from GI tract, that is gastrointestinal tract, to blood, it will take three steps. There are three major routes by which, the three major mechanism by which the drug get absorbed. The name of these mechanism is paracellular transport, transcellular transport, and vesicular transports, okay. What do you mean by that? Means the drug, before it reaching to the systemic circulation, it will follow paracellular, either paracellular, transcellular, or vesicular transport. Now what do you mean by that? Paracellular transport. Paracellular transport means, the in GI tract there is a membrane known as GI membrane, okay, and through which drug is likely to get cross. Drug has to cross that GI membrane, okay. Now that GI membrane is composed of cells, many cells. It is basically tissues are further compromised or further broken down. If you see magnificently, then it is made up of many cells, okay. Now the space between two cells, if a drug passes through the space between the two cells, that process is known as paracellular transport. Means the drug will cross the GI membrane via the membrane, the gap between the cells, okay. So that type of absorption is known as paracellular transport. Now second type of absorption process is transcellular transport. Transcellular transport means drug is going to pass the membrane across the cell. Across the cell means it will not go through the pores between the cell, but it will cross entire cell, from one cell to another cell, from one side of the cell to another side of cell. So that process is known as transcellular transport. And the third mechanism by which the drugs get absorbed is vesicular transport. Vesicular transport means the drug, when comes in contact with the cell recognize it as a foreign particle, and they will form a vacuole. Vacuole is an empty space. They will create an empty space so that it is going to engulf that drug, okay. And in the process of engulfing the drug will get across the cell membrane. So that is how the drug gets transported. So again, three types: paracellular transport, that means between the cells; transcellular transport, across the cells; and vesicular transport, that means via formation of vacuoles, okay. Now these are the three major routes by which any drug you take into the body, these are the three routes by which the drugs get likely to be absorbed, okay. Now if we talk, the majorly the drugs are absorbed by transcellular transport, that means across the cell, okay. Now basic mechanism by which drugs get absorbed is known as passive diffusion. These terminologies are frequently used in the field of pharmacy. So passive diffusion is the process of movement of drug from higher concentration zone to lower concentration zone, okay. So whenever the concentration of drug at this side is high and this side is low, the drug is likely to move from higher concentration zone to lower concentration zone, and this is what happens in the case of transcellular transport. All right. Now the last mechanism, the famous example you have heard of, polio vaccine, okay, Sabin polio vaccine. This is the drug which is absorbed by Vesicular transport. Vesicular transport is of two types again. Phagocytosis, if the drug is absorbed by the solid particle, then it is phagocytosis, and the drug is when absorbed, when the liquid drug is absorbed, that is known as pinocytosis. Okay, so polio savin vaccines are absorbed by pinocytosis process, right? Thank you so much.